Let's kick it!
I'm Cindy Perlin, and I'm the creator of the Alternative Pain Treatment Directory at paintreatmentdirectory.com, and I'm kicking it with Doree.
Welcome to the Kicking It with Doree show. I'm your host, Doree Allen Nieves, and I am really excited about our guest today, who is none other than Cindy Perlin. Cindy Perlin is a licensed clinical social worker, a certified biofeedback practitioner, a chronic pain survivor, and the author of The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. She's also the creator of the Alternative Pain Treatment Directory at paintreatmentdirectory.com. She has had a private practice in the Albany, New York area for over 25 years. Awesome, Cindy. Welcome to the show.
Thank you.
I am no stranger to Central New York. My grandma lived in Albany in the Troy area for well over 50 years, so we visited her often. I am really pleased to have you here today because you are talking about something that is close to home for me, and that's chronic pain. There are probably like hundreds of millions of people in America alone that suffer with chronic pain, and they're using a lot of the opioids and other kinds of treatments that doctors are giving, just your standard medical doctors. And you today are going to be sharing with us and educating us about effective natural methods of pain treatment. And you're an expert at this. You're a survivor of chronic pain. And so I'm really, really happy to have you share your knowledge with us today.
Well, thank you.
Our traditional methods of pain management, like especially me with my husband and his chronic pain that he's had for 2 years, is to go to the pharmacy or to have surgeries in order to treat or to heal pain. And oftentimes it doesn't work. There's people that are like spending hundreds, thousands of dollars on pain prescription medication and having surgeries upon surgeries, getting hospitalized. I can't tell you how many times he was hospitalized in 2017, and not really getting any lasting relief, not for their physical pain or the mental anguish that ensues. And as a caregiver, there's a lot of mental anguish that goes along with loving and caring for someone who has chronic pain.
Yeah, so, what's most in the news these days is opioids and the opioid crisis and the talk about how many people are becoming addicted to opioids. And unlike what the pharmaceutical companies have been telling people, pain patients can get addicted to opioids. Not every pain patient gets addicted, but a lot of them do. And on the other side of that, people think that they're getting a lot of pain relief with opioids, but what happens is that they take the opioids and then their body adapts and then they need more, and then their body adapts and then they need more. That's called tolerance. The higher the dose, the higher the risk of adverse consequences, including addiction, immune suppression, problems with driving. 21% of fatal accidents involve an opioid. And the worst part of it is that any study that's looked at use of opioids over a long period of time says that people who use opioids actually end up in more pain than people with similar medical conditions of similar severity who don't use opioids. The latest research shows that opioids actually cause more pain in the long run. So they're not a good solution on so many different levels. But there's been so much marketing around them that they're the best possible medication or treatment for pain that a lot of people believe that.
And just to make sure that everyone is on the same page, can you just give a few quick examples of opioids?
Okay, well, they're oxycodone, hydrocodone, often sold under different brand names. Fentanyl's another one. So Lortab, Percocet, Vicodin, OxyContin, those are just some of the brand names. Morphine is another one. Sometimes methadone, which has historically been used for addiction management, is now being used for pain. Tramadol is considered a weak opioid. Those are some of them.
Yeah, and unfortunately, I'm familiar with most of those names. And you're right, they don't solve the problem. Now, there are many safe and effective pain treatments that doctors are not telling patients about.
Right, there are. There are so many of them, and I'm learning about new ones every day, even though I've been at this for decades. So, there's things that you can take that will immediately help with pain, and there are things that you can work at over time that will tend to reduce your pain levels. So, one of the most effective pain treatments, and unfortunately it's not accessible everywhere, is medical marijuana. Medical marijuana has compounds that our body naturally makes to relieve pain and inflammation. And marijuana has been demonized. It's been made illegal. People have gone to prison for long periods of time for using it. But it's been used medically for thousands of years. And the scientific evidence with actual clinical studies is growing that it's a very safe and effective pain reliever. If people are in states where medical marijuana is not legal, you can get hemp-derived, what's called CBD oil. CBD is one of the components in marijuana that helps with pain, and hemp is a close relative of the marijuana plant, and it doesn't contain the psychoactive ingredient that's in marijuana, which is THC, but it does contain CBD, and CBD is legal nationwide, and you can get preparations online that can be very helpful for chronic pain. Another herb that's very effective that people are using is something called kratom. And kratom is a Southeast Asian herb that, again, has thousands of years of use in medical preparations in some parts of the world, and it's a great pain reliever. Both medical marijuana and kratom help people withdraw from opioids, because if you're on opioids and you stop taking them, you go through a withdrawal period that can be extremely unpleasant, including increased pain, nausea, tremors, increased anxiety. The reason that people get addicted is when they try to stop, they get this horrible withdrawal and they go back to dosing. But both medical marijuana and CBD and kratom will help with that.
And you said that those things are available online?
Yes, they are. And, I would say that when people are searching online to look for products that are vetted, that somebody has tested for purity and that, the product actually contains what it says it does. There's an American Kratom Association that has information about that, and that's KRATOM. So there's American Kratom Association. If people are on Facebook, there's a Kratom New and Current Users group, and they have a list of kratom producers that they consider trustworthy. So, like anything, quality of product varies.
Yeah, I got to be very careful.
According to the National Safety Council, combining Tylenol and ibuprofen is actually a much more effective pain relief strategy than taking opioids. You don't want to take Tylenol too much or too often, or any of the nonsteroidal anti-inflammatory drugs, because they can increase your risk of heart disease and stroke. So you want to take those in moderation also, but they are effective pain relievers. I just read an article about opioids that was kind of interesting. The author, who's a doctor and a researcher, said that there's more problems with the way that opioids are prescribed today than there used to be in the past, because now when people are prescribed opioids, they're told to take them round the clock. And they're much more likely to cause problems than if people only take them when they really need them. Mm-hmm. So, another thing to think about if you're on opioids, if you can cut down to, when you really need them and supplement with these other things. Some people use both. Marijuana prevents an escalation in dose. It prevents development of tolerance. So, that's another strategy, is to incorporate some other things so that you don't continue to escalate your dose of the opioids. Another thing that people can take is homeopathic preparations. Homeopathy is a system of medicine that was developed about 200 years ago, and it uses diluted substances, things that if you took them full strength and you were healthy, you would develop the symptoms that you're having. And the idea is that the symptoms that you have are your body's attempt to deal with a problem. And by taking these very, very minute doses, it stimulates the body's healing system. And evidence is growing that homeopathy is very effective. And I've been using homeopathy for about 30 years. Instead of taking ibuprofen if something is hurting, and if I decide to use a strategy of taking something, I use a homeopathic remedy called arnica, which is good for muscle pain, or ruta, R-U-T-A, which is good for inflammation. If it's something like a tooth extraction and I'm having nerve pain, there's something called hypericum. So there's a lot of things you can actually take. If you're a migraine sufferer, even the U.S. Headache Consortium says that the most validated and effective treatment for migraines is an herb called butterbur. So there's a lot out there in terms of things that you could take that will relieve your pain right away. And then there are longer term strategies, body-based therapies like physical therapy, chiropractic, massage, mind-body therapies where you use your mind to relieve your pain. And those are things like meditation and relaxation strategies, biofeedback, cognitive behavioral therapy, some of the newer trauma techniques, because oftentimes trauma is behind persistent chronic pain. So there's things called emotional freedom technique and EMDR, eye movement desensitization and reprocessing that could be really useful for pain. There's devices that speed up healing, like low-level laser therapy devices and pulsed electromagnetic frequency devices and various electrical stimulation devices that help pain. So there's so much out there, and most of it your doctor won't tell you about, and most of it people don't know about.
Mm-hmm. We have a mutual friend whose wife is a nurse, and when my husband was visiting her, she said, you need to try to get your hands on something called Marinol, and that will probably help you.
So Marinol is a prescription drug that is synthetic THC. So it's a synthetic compound that mimics what's in natural marijuana. And I took Marinol to see what would happen. It's a prescription drug. It's, I think, FDA approved for cancer treatment for patients who are having nausea and vomiting and wasting from cancer. And because it's synthetic, it has more side effects than the natural. And I decided when I hurt my back one day, a friend of mine had a prescription for it, to take one and see if it would help, because I've been researching medical marijuana. And I ended up in the emergency room.
No.
Because I started feeling dizzy and lightheaded, and I decided to look it up on the internet and see what the side effects were. And it said that if you were lightheaded and your pulse was elevated, to call your doctor immediately. So I took my pulse, and it was up around 140, and I was just sitting there. So I called 911 to see what they thought, and they decided to dispense an EMT to my house, who insisted on taking me to the emergency room because my blood pressure was way up, my heart rate was way up, and they were afraid I'd stroke out. And I just took like a small dose. So I ended up in the emergency room. By then, things had calmed down because the drug was wearing off. But it's very curious that nationwide, federally, marijuana is illegal, but the FDA is approving drugs that are basically derived from marijuana. and declaring them okay, even though they're not as safe as marijuana.
Wow. Yeah, you gotta love the FDA. That's another whole podcast right there.
In fact, I was talking about homeopathy a little while ago, and last week the FDA declared homeopathy illegal.
Wow.
Homeopathy has been part of the U.S. Pharmacopoeia, which is a list of generally accepted as safe medications in the United States, and it's been in there for 100 years. And they declared that they were not proven, and that they all had to go through the drug approval process before the FDA would accept them as legal.
Okay.
And this is in the absence of any adverse event reports or anything else. It's still on the shelves, and they say they're not going to take everything off the shelves right away, but they basically declared it illegal.
Thank you for giving us that list of different options that we have. And I will put this list of Cindy's recommendations in the show notes for this episode. Let's talk about your new online alternative pain treatment directory.
Okay. So it's at paintreatmentdirectory.com. And what it is an online resource for pain patients. It has a lot of information. It has articles about alternative treatment. It has inspiring healing stories by people with severe pain who, sometimes had pain for decades, and they healed with natural methods once they discovered and started using them. And it also has products, many of them little known, that are good for pain relief, that are all natural. And it has provider listings of alternative providers. And that list is, since the website is only about 3 months old, that list is growing. It's still small, but we do have a lot of providers who do phone consults, including myself, who are nutritionists or psychotherapists or mind-body healers of one kind or another, who can provide phone advice. And there are some web-based programs, including one web-based program on mindfulness meditation, which is very useful for chronic pain, and that one's free.
Excellent.
So, the mind is very important in pain relief, and most people who have pain get upset when you say that, because they say, you're saying the pain is all in my head. And that's not what I'm saying. The pain is real, it's physical, but the mind plays a real large role in how much pain you're feeling. It's the brain that interprets the signals it's getting from the body and generates the pain signals. So the brain is very important. When you're calm, your physiology is more likely to reduce pain. And when you're stressed, there's changes that happen, like increased muscle tension, reduced blood flow to your extremities, increased heart rate and respiration, decreased digestion and immune response, that have an impact on pain. So learning to stay calm is really helpful in pain relief. A lot of times, pain is exacerbated by a history of trauma. There's research that says that people who had traumatic childhoods are much more likely to have chronic illness. And what I've seen in my practice is that people who had a lot of childhood trauma, and I'm talking about things like emotional abuse, physical abuse, sexual abuse, living with an alcoholic parent or a parent who abuses drugs, living in a home with domestic violence, even if you're not the target. All those things create chronic childhood trauma where you don't feel safe. And what happens is that the brain develops in a way that the person never really relaxes. The brain is always on hyper alert. And over time, that really takes its toll on the body, and people experience a lot of chronic illness. So there are ways to get the brain to calm down and to rewire the brain or process the trauma. so that people are calmer, and that can really help pain.
Yeah, I can see how the brain might switch into that mode, almost like a defense mechanism. Like, okay, I remember when I was like this before and this is, how I coped, but it's not helping. It's just a default. It's so, so important, your mind, how you process the pain and, what you're thinking about. And for the person that is a caregiver, that it's also very difficult to know how to help. The default would be, okay, let me, get a pill to help this person or whatever. And I know there's all kinds of controversies about a caregiver might do something that might be considered ethically wrong. I'll give you a simple example. Like somebody is really, really hurting and they're taking Percocet and they're supposed to take just one every, 6 to 8 hours or something. And they give them 2 pills instead of 1.
Yeah, I mean, when you see someone suffering, it's very difficult. Before I had a lot of the skills that I have now, my father, was in the hospital. He's long gone now, but he was in the hospital and he was, very out of it. And I could tell that he was really suffering. And I just felt so helpless watching him and didn't feel like I had any way to help him. And I went and I learned some hands-on energy balancing techniques after that. Something like Reiki or polarity. Those skills which are, really demonized by conventional medicine. They think that's all hogwash. But it helps. Nurses are learning therapeutic touch so that they can do, hands-on treatment with their patients and reduce their pain. So even something simple like putting your hands on someone, putting your hands, in a good way on somebody who's suffering is always helpful because there's healing in touch. So even if you can't do anything else, just touching the person can be helpful. But there are specific practices that you can learn that can help. And as I said earlier, there are other kinds of pills that can be helpful or other kinds of things that, people can ingest in the moment. And even, when pain comes up, people are in a lot of fear. And so you want to take their mind off of it. You want to maybe have them visualize something positive or something calming. You can have visualizations where wherever the pain is, however they imagine it to be, it's shifting into something more pleasant. There are guided meditations you can get on CD or MP3 files that can help with pain in the moment. If the person's alert enough that they can be aware of input coming in, laughter is a pain reliever. When you laugh, your body produces endorphins, which are natural opioids. So, if you can have them focus on something funny. I recently discovered Sirius XM radio, which is satellite radio. There's 4 comedy stations where they have stand-up comedy. 3 of the stations are 24/7, and the other one, I guess, isn't on 24 hours a day. But anytime you need a laugh, you can turn it on. And if you're a subscriber, which costs about $15 a month, you can download the app to your electronic devices and listen to it anywhere. So, getting the person to laugh, putting on a funny movie on a DVD or Netflix or whatever, that's a pain reliever. So, in the moment, it doesn't have to be a pill. It can be some other things that can help reduce pain.
Yes, I agree 1,000% with what you're saying about the laughter. Very much. Cindy, this episode has been a very enlightening one, just touching the surface and giving ideas about different things that we can do, including laughing more. And, it takes more research. It takes, understanding that there's a different way, a better way than just taking, a narcotic or something. So I appreciate you educating myself and all of my listeners today with this.
Yeah, and if people want an overview of all of this, that's basically what my book is. The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. That's an overview of everything that we've just talked about with references and resources. So I encourage your listeners to check out the book.
And how can we get in touch with you, Cindy?
You can go to my website, paintreatmentdirectory.com, and fill out the contact form.
Awesome. All right. Thank you so much. And please share with us your comments and questions. My website is kickingitwithdoree.com. You can leave a comment in the show notes for this episode, or you can get me on social media at Doree Allen, DareeAllen. Thank you.
Thank you.
Thank you for listening and for kicking it with me. If you enjoyed this show, please subscribe and tell your friends about it. Kicking It with Doree is brought to you by DAREE. That stands for Delivering a Rich, Empowering Experience. Visit me online and join my email list at DoreeAllen.com.